DYMISTA Nasal Spray contains the active ingredient azelastine as hydrochloride and fluticasone propionate. Azelastine is an antihistamine that reduces the effects of natural chemical histamine in the body. Histamine can produce symptoms of sneezing, itching, watery eyes, and runny nose. Fluticasone is a steroid that prevents the release of substances in the body that cause inflammation. Indications. DYMISTA is used to relieve the symptoms of allergies, for example, symptoms relating to the nose, runny nose, sneezing, itchy or blocked nose, and symptoms relating to the eyes, itchy, watery, and red eyes. How should I use DYMISTA? Use DYMISTA exactly as prescribed by a doctor. Follow directions in your prescription label and read all medication guides or instruction sheets. Shake the medicine bottle gently just before each use. Avoid getting DYMISTA in your eyes or mouth. If the medicine gets in your eyes, rinse with water for 10 minutes and then call a doctor. Do not allow a young child to use this medicine without help from an adult. Store DYMISTA Nasal Spray in an upright position at room temperature. Do not freeze or refrigerate. Throw away the medicine after you have used 120 sprays, even if there is still medicine left in the bottle. How to use. Usual adult dose for allergic rhinitis. 1 spray in each nostril twice a day. Uses. Relief of symptoms of seasonal allergic rhinitis. Usual pediatric dose for allergic rhinitis. 6 years and older. 1 spray in each nostril twice a day. Contraindications. Hypersensitivity to the active substances or to any of the excipients. Warnings. Systemic effects of nasal corticosteroids may occur, particularly when prescribed at high doses for prolonged periods. These effects are much less likely to occur than with oral corticosteroids and may vary in individual patients and between different corticosteroid preparations. Infections of the nasal airways should be treated with antibacterial or antimycotical therapy, but do not constitute a specific contraindication to treatment with DYMISTA Nasal Spray. Side effects. DYMISTA may cause serious side effects, including sleepiness or drowsiness. Nasal problems. Symptoms of nasal problems may include crusting in the nose, nosebleeds, runny nose, hole in the cartilage between the nose, nasal septal perforation. A whistling sound when you breathe may be a symptom of nasal septal perforation. Slow wound healing. You should not use DYMISTA until your nose has healed if you have a sore in your nose, if you have had surgery on your nose, or if your nose has been injured. Thrush, Candida, a fungal infection in your nose and throat. Tell your healthcare provider if you have any redness or white color patches in your nose or mouth. Eye problems such as glaucoma or cataracts. Some people may have eye problems, including glaucoma and cataracts. You should have regular eye exams when using DYMISTA. Immune system problems and increased risk of infections. DYMISTA may cause problems with the way your immune system protects your body against infection and increase your risk of infection. Avoid contact with people who have contagious diseases such as chickenpox or measles while you use DYMISTA. Symptoms of infection may include fever, aches or pains, chills, feeling tired. Adrenal insufficiency. Adrenal insufficiency is a condition in which the adrenal glands do not make enough steroid hormones. Symptoms of adrenal insufficiency may include tiredness, weakness, nausea, vomiting, low blood pressure, slowed or delayed growth in children. A child's growth should be checked regularly while using DYMISTA.